We are now going to, according to seniority, I think now it is CTPH. Dr. Gladys Kalema, come in 5 minutes' time and tell us more about the CTPH.
Good afternoon, everybody. Very excited to be here. Following on from the discussions and points that have been put forward by Mr. Jimmy Muhewa, Mr. James Biamukama, communities are a resource. And they're really saving us a lot of money in conservation, but they're also the major beneficiaries. My journey with communities actually began when I was still at UWA, working as a first veterinary officer. When people made gorillas sick, and everybody said, they pointed to me being the only vet in the organization and said, we want you to start a public health program in the local communities. I remember there was Stephen Asuma from International Gorilla Conservation Program, and everybody in the park said I should be the one to do it. And that's when my journey with communities began. Because when we went to the communities with the community conservation warden and rangers, very resourceful people. We also had to go with the district health assistant. And I told them what the problem was. This is how gorillas got sick. They went into community gardens, touched dirty clothing, got scabies. And I was about to tell them the solution. And the ranger touched my hand and said, let's hear what they have to say. They came up with much better solutions than I was proposing for them. So what does that tell us about communities? They know what is best for them. Our job is just to facilitate it. And that was a very humbling moment for me as a vet doctor used to solving people's problems. And when we engage communities, we really need to let them lead the efforts. Let them drive their solutions if they're going to last for a long time. So we set up CTPH together with Stephen Rubanga, who's not here, and my husband, Kalema-Zikusoka, who's here today. And it's been a journey of engaging communities. We've worked very closely with the UWA community conservation departments at Bwindi and also other protected areas like Queen Elizabeth National Park. And we've really learned a lot. But because we are improving the health of people together with animals, we have to work with the public health sector. They are much better at engaging communities. We have to learn from them. Because for them, it's about numbers. How many people have you reached? How many services have been delivered? And so we discovered that they have a very efficient system of reaching communities. Because Bwindi, where I started my journey, had been having integrated conservation development initiatives for many years, but a study was done around the time that we founded Conservation Through Public Health. It was done by ITFC, Institute for Tropical Forest Conservation, Dr. Alistair McNeilage and his team. And they found that the poorest people are still not benefiting from conservation. When you have a meeting, it's the elites who come into the community and understand the benefits and improve. But those who are still poaching will continue poaching because they don't know what is happening. They're just so busy guarding animals in their garden. They're so desperate, they're still going in. So when we started CTPH, we were like, no, we have to reach the poorest of the poor. These are the people who interact with gorillas and other wildlife and more likely to harm the wildlife or get harmed by wildlife. And so we started to work with the public health groups, and they started a system of village health teams. So having selected volunteers ourselves with the local leaders, we then started working with the VHT system. And we started off with 26, we used to call them community conservation health workers, who reach everybody's home. They talk about good hygiene and sanitation so that they don't get preventable diseases like scabies, tuberculosis, HIV, those kind of diseases, ringworm. But they also talked about good nutrition, and we started to promote community-based family planning. One of the biggest problems to our protected areas is very high human population densities. And so they were able to do that. And then they also started talking about how to access ecotourism revenue from UWA. UWA gives money to the communities every year, but not all of them receive it, and not all of them know how to access this funding. So all of that was very important. And as I speak now, we are reaching, those 26 volunteers reached about 2,000 homes, but not very well. Later on, we started, when government VHT system reached Bwindi, we decided all VHTs must become village health and conservation teams. And the program has really grown. Right now, we're reaching 400. We have 430 volunteers. They do so much work. At CTPH, we're a staff of 25 in CTPH, 15 in the social enterprises. There's no way we'll be able to reach 10,000 homes with over 50,000 people. But through these 430 volunteers, we're able to reach all these homes in parishes where gorillas are always going out. So you can see all the work that the community is doing. They're not being paid a salary by anybody, not by the Ministry of Health, not by UA, but they're promoting all of this, preventing people from poaching, telling them the dangers of poaching. And we're also finding that homes are changing over time. So we started to realize that someone may have a hand washing station, but they're still poaching, or they don't have a toilet. So we developed a system of 12 ideal indicators in 2022. So if you have less than 12, you're a red home. If you have between 5 to 9, 5 to 8, you're an orange home. If you have 9 and above, you're a green home. So when we did a survey, we found that 23% of our homes were green. 23 were red, about 50 were orange. But now, 2 years later, 58% are green, and we're very excited about it. So we're showing change. Thank you. And now we are also comparing with UA, whether there's less poaching in those communities because their health is improving, their well-being is improving. We're also tracking things like, do they have a food crop garden? During COVID, you heard about the famous gorilla Rafiki who was poached because he was poached by people who are hungry, a hungry bushmeat poacher. So we started a program called Ready to Grow, where we provide fast-growing seedlings to the most vulnerable communities. And actually, the poacher's wife was one of the beneficiaries. She was very poor, only 22 years old with 3 children under the age of 3. So now she's receiving family planning services. And so we try and make sure, and people told us when we distributed a questionnaire, 1 to 1,000 people, majority said people are poaching because they're hungry. So now we've stretched out to 3,000 homes, and all of these people are improving on what they're doing, and we're trying to track to see, is there less poaching? Is there less zoonotic disease going to gorillas as community well-being? Because if the community is not doing well, there's no way that we'll be able to protect the wildlife. With the coffee farming, which has already been mentioned, we are engaging 630 farmers. We started off with 75. 5 were women. And now of these 630, 230 are women. And guess what? They're farming better than the men. So we want to stretch, and so many farmers want to join this initiative because they get a good price for good coffee. And the tourists want to buy this coffee because they want to support the communities where they're going. They don't want to just see gorillas, they also want to support the communities. So I'm about to finish, but I'll end up by talking about women in conservation. It's very, very important. Half of our village health and conservation teams are women. In this room, actually I'm seeing more women than there used to be, but we need more women speakers. I'm the only women speaker today, I think, and I'm so glad that the permanent secretary is here, Madam Doreen. We need more women in conservation, and I wrote this book. I have a chapter on women in conservation, working with gorillas. I hope you enjoy reading it. It's not easy being a woman in conservation. You're surrounded by men. But I know when we started at U, I got a lot of support from Captain Otekat and Dr. Arthur Mugisha. They really supported me. And now we're seeing very many more women. There were no women rangers. Now 20% of the women, of the rangers are women. So because of our One Health approach, which mainly engages women in health and men in conservation, women are more involved in conservation and men are more involved in healthcare. So this is what I have to say. Communities can actually lead conservation efforts. These people I'm talking about collect data. You can see it. So we have data on over 10,000 homes around the national park. And this model is scalable. It can go to any protected area in Uganda because there are VHTs, village health teams, everywhere in Uganda. You just have to add the conservation component. They also plant trees. I heard about carbon credits. So the stakeholders who focus on carbon credits, please work with us. so we get them to earn more from carbon credits. And it's an evolving ecosystem which we'd like to continue to scale and work together with our partners here. So I hope that I've kind of explained our community-driven model. Thank you very much.